Does HIV testing requiring blood or saliva samples for accurate results? When it comes to HIV testing, you might wonder whether blood or saliva samples are needed for accurate results. The good news is that both methods can provide reliable information about your HIV status, but they work a bit differently. Let's break it down. Blood samples are the traditional method for HIV testing. They can be taken from a vein or through a finger prick. Blood tests can detect HIV antibodies, which are proteins your body makes in response to HIV. They can also identify HIV antigens, like the P20 for protein, which appears earlier than antibodies. Additionally, there are nucleic acid tests that can detect the virus itself. Blood tests are known for their high sensitivity and specificity, often nearing 100%, making them very accurate in detecting HIV infection. On the other hand, oral fluid samples, which are collected by swabbing the gums, are another option. These samples contain oral mucosal transudate, which includes antibodies but not the virus itself or blood. Oral fluid tests are non-invasive and painless, making them a great choice for self-testing and for reaching populations that might be hesitant about blood draws. Studies show that saliva-based antibody tests have high accuracy, with sensitivity around 99% and specificity close to 100%. However, they may have a slightly longer window period for detection compared to blood tests. Now, let's talk about accuracy and limitations. Blood tests can detect HIV earlier than oral fluid tests because they can identify both P20 for antigen and antibodies. Rapid point-of-care tests using finger prick blood are common, but they may have slightly lower sensitivity than laboratory tests. While oral fluid tests are highly accurate, they may not be as sensitive during the early stages of infection. In cases of recent infection, or if someone is on HIV prevention drugs, the antibody response may be delayed, affecting test accuracy regardless of the sample type. In the context of sexual health and sexually transmitted diseases, oral fluid HIV tests are valuable for community screening and self-testing. Blood tests remains the gold standard in clinical settings, especially when early detection is critical. If an initial test result is positive, follow-up confirmatory testing is necessary for both sample types. Regular testing is recommended for sexually active individuals, particularly those at higher risk, to enable early diagnosis and treatment. This can significantly improve health outcomes and reduce transmission. In summary, HIV testing does not strictly requiring blood samples for accurate results. Saliva samples can also provide reliable detection of HIV antibodies. However, blood tests generally offer earlier detection and slightly high accuracy, especially for recent infections. The choice between blood and saliva testing often depends on the context and accessibility, as well as the need for early diagnosis in managing sexual health and STDs. Always consult with a healthcare professional for personalized advice regarding testing options.